Welcome to my presentation. I'm Vanessa. Today, I will talk about Crohn's disease. I will discuss the causes, pathophysiology, symptoms, and pre-hospital treatment. So, let's begin. So, what is Crohn's disease? Crohn's disease is a chronic inflammatory bowel condition characterized by immune cells attacking healthy gut tissues, primarily affecting small intestines and colon. With the current data shows it is more prevalent in North America, Northern and Western Europe, and Oceania. Now let's have a look some data from 2019 to 2020. In Australia, women experienced a higher hospitalization rate than men. This hospitalization rate also rises with age. During the same period of time, there were over 12,000 female patients and nearly 7,900 male patients. Next slide, I will discuss some possible causes of this condition. The exact cause of Crohn's disease is still unclear. However, some studies suggest genetic, immunological, and environmental factors may play a role in its onset and progression. Before we delve into pathophysiology, let's just have a quick review of a normal structure and functions of small intestinal tissue. As we can see on the left, from the innermost to the outermost, um, we can see four distinct layers. These are mucosa, submucosa, muscularis externa, and serosa. The mucosa serves three primary functions. It facilitates secretion through goblet cells, enables absorption, also provides protection against pathogens. The submucosa contains a network of capillaries where absorbed nutrients are directed into the hepatic portal circulation for transportation to the liver. This layer also houses large nerve endings known as the submucosal plexus, which is part of the enteric nervous system, helping to regulate digestive processes. The muscularis externa is the thickest layer, consisting of smooth muscle that plays a crucial role in peristalsis. Finally, the serosa is a connective tissue layer that covers and anchors the intestine. In the case of Crohn's disease, the intestinal barrier function becomes compromised due to dysregulated innate and adaptive immune responses. Lymphocytes, such as macrophages, neutrophils, are recruited to the epithelium in response to pathogens or food allergens or bacteria. However, to maintain normal gut homeostasis, neutrophils may engage in excessive phagocytosis, which undermines the epithelium barrier function and results in the production of inflammatory mediators. T cells contribute to inflammation by releasing a variety of cytokines, which further intensify the inflammatory response by stimulating macrophages and endothelial cells to generate more pro inflammatory mediators. So, to differentiate Crohn's disease from other inflammatory bowel diseases, the inflammation penetrates through all the layers. These characteristics can eventually cause structural changes in the intestine. which will reduce lumen diameter and form tunnels within the intestine. It is reported that nearly one third of the patients with Crohn's disease have some degrees of anemia due to these pathological alterations. So next slides we'll discover some signs and symptoms. What are the signs and symptoms people can present with Crohn's disease? Well, some symptoms are more prevalent to the others, such as abdominal cramping, frequent diarrhea, weight loss. People may feel fatigued. Symptoms that are less common but still important to know, such as mild fever, skin rashes. People may find mucus or blood in their stool, mouth sores. Some people experience some degrees of iron deficiency. This is due to the impaired normal intestinal function. So, how are we going to treat these patients in pre-hospital setting? Our primary focus for managing these patients will be on treating their symptoms. This includes providing adequate pain relief and possibly administering IV fluids if the patient shows signs of dehydration. It is crucial to collect a comprehensive of physical examinations, medical history, and various investigations, especially in cases of acute abdominal emergencies. We must recognize the signs of obstruction to ensure that patients receive definitive care. Common symptoms of small bowel obstruction include constipation, abdominal distension, and severe pain. Vomiting is also a prevalent symptom associated with small bowel obstruction, varying based on the location. Generally, if the obstruction is proximal, the vomit will consist more of gastric content. However, if the patient experiences fecal like vomiting, this indicates a lower obstruction. Regarding nausea and vomiting, we could give antiemetic drugs. Additionally, we need to identify and evaluate patients who might be at risk of perforation, as this condition requires emergency surgery. Thanks for watching. I hope you enjoy my presentation.